Yesterday was Lichen Sclerosis Day. Can you tell us what that's all about?
Yeah, lichen sclerosis is an autoimmune sort of inflammatory condition that can create a lot of scarring at the vulva. It's a skin condition that attacks the skin. It can happen in other places, but we see it commonly in the vulva. It's not rare. And so if you have any sort of white looking, almost thin, papery, itching and scarring, you're losing your labia minora even, and you need to see a doctor who specializes in lichen sclerosis. Now, some dermatologists do it, some vulvar specialists do it as well. And there's two really important strategies when you're treating lichen sclerosis. First of all, it is imperative that you get a biopsy and a diagnosis, because that inflammation can turn into vulvar cancer. And you can prevent cancer by getting rid of the inflammation and treating lichen sclerosis. So it's really important that you get a good diagnosis. And it's also important that you are treated with maintenance therapy for life, because you have to keep that inflammation away. Now, what I find is an often mistake is that people are just given topical steroids to fix the lichen. And it's very important that you use topical steroids to prevent and treat lichen sclerosis. But it is just as important to treat the hormonal changes, because what happens is because of the menopausal hormone depletions, that inflammation kind of goes into overdrive. And so by treating the hormonal piece of it, you can keep the tissue strong, healthy, lubricated, acidic. So you got to do two things. You got to treat the hormones and you got to treat the inflammation. And so it's often a local topical hormone and a steroid used, a couple times, one or two times a week as maintenance therapy once you treat it aggressively to prevent it from ever coming back. Does that make sense?
It does make sense. However, I want to ask you, sort of segue into this idea. I'm sure there are women who are suffering with thinning vaginal skin, dryness, irritation, painful sex, and do not have lichen sclerosis. So can you speak to that?
So it's really important so oftentimes you got to treat the genitourinary syndrome of menopause. You got to treat the hormonal piece. And then so often in my clinic, what I'll do is if I suspect lichen sclerosis, right, we treat hormonally aggressively and then bring them back and then look at places to biopsy and then add the lichen treatment for that, because we find that a lot of it, which looks like lichen, is actually just this hormonal depletion. And a lot of people don't have lichen at all and get misdiagnosed with lichen sclerosis. So that's why a biopsy is pretty important there.
Yeah.
But it's really important that the tissue needs that hormonal support. And without it, you're going to have dryness and pain, irritation, itching. Oh my gosh, I can't wear tight pants anymore. I can't sit anymore. Wiping hurts. I forget intimacy with my partner. Like all of that is quote unquote normal. It's not normal. And there's so much we can do to fix it.